Mesothelioma histology includes the steps. Medical doctors perform a tissue biopsy on a patient to collect tissue samples. The tissue samples are dispatched to a laboratory in which an experienced pathologist will overview the samples and search for epithelioid, sarcomatoid, or biphasic mesothelioma cells. Histology system for analysis of mesothelioma. Histology samples accrued from a biopsy are placed right into a field with a preservative and then sent to the pathology lab for examination. The first check finished by a pathologist is a gross examination, which means that the tissue sample is reviewed without the use of any equipment. The pathologist will take a look at the specimen with their naked eye and file their observation. In a few cases, an image is taken as well. Pathologists perform a gross examination to determine whether or not a sample appears cancerous and to determine which parts of the pattern have to undergo a further exam. Mesothelioma samples are usually small, allowing pathologists to check the complete specimen straight away. The pattern is positioned into a container referred to as a cassette in which it is going to be processed for a few hours, earlier than being positioned in a hot paraffin wax mold. The wax is then left to cool and harden. As soon as the wax shape is stable throughout, an instrument referred to as a microtome is used to slice the tissue into extremely skinny slices. It's then placed on a glass slide and dipped into dyes, coloring the cells so they may be less difficult to peer. Pathologists consider numerous factors when searching out mesothelioma cells, along with cell shape, length, composition, and popular behavior. Finally, the pathologist can observe the biopsied tissue below a microscope. Mesothelioma specialists endorse electron microscopes for this manner, which use electron beams to create pretty distinctive pictures magnified to much stronger resolutions than traditional mild microscopes. Frozen segment exam. In some cases, histologists will assess a tissue pattern at some stage in the middle of a patient's surgical procedure to assist surgeons to make immediate choices. This shape of biopsy processing is known as a frozen phase exam, and it normally takes 10 to 20 minutes. Rather than using wax, the tissue is located into a specially developed solution that encases the tissue and forms an ice cube. Subsequently, the dice are sliced into skinny sections, dipped into numerous staining dyes, and then reviewed under a microscope. A frozen phase examination isn't always as accurate or clear as the traditional histology method. However, it's frequently good enough to allow surgeons to make speedy decisions. The most common makes use of a frozen segment exam is to identify whether or not a particular mass is malignant or benign and to determine whether or not a surgeon has eliminated enough of the tissue to seize all most cancers.